Is Canada's healthcare system failing to meet the needs of Canadians and in need of serious reform? I'm here outside the Saanich Peninsula Hospital in Victoria, BC, where not long ago they were forced to close their doors of their emergency room and turn away patients due to a nursing staff shortage. The latest example of a system buckling under pressure in part due to COVID-19. Unfortunately, when you look a little closer, the problem goes much deeper than that. The truth is, Canada's COVID-19 case numbers and hospitalizations have been relatively low compared to most other developed countries. And yet Canadians keep hearing stories of hospitals nearing capacity and critical care staff burning out. That's because much of this country's healthcare system pre-COVID-19 was already running at or near full capacity, and staff shortages, especially of doctors and registered nurses, were already acute. The issue is that instead of contemplating or proposing serious reforms, our politicians seem content to just throw more of your money at the problem. But here's the thing, if it was simply a matter of increasing funding, this all would have been solved long ago, because governments have been throwing money at the system over and over again, and nothing has changed. Instead, it should be obvious by now that we desperately need bold new ideas. For one thing, we need to be training more doctors and more nurses. Canada has some of the fewest doctors per capita, for example, in the developed world, while nurse shortages in places like here in British Columbia have created a dangerous situation where some burned out nurses are actually quitting and moving on to other careers, making the problem even worse. And this includes 2 young nurses that I personally know. This situation has been created in part due to a misallocation of human resources in our society, with universities and governments often subsidizing disciplines for which there is little to no demand, while essential services like nursing and medicine remain chronically understaffed. In addition, Canada's government-run and centrally managed system is not helping at all either. Wait times, already horrendous for a huge number of healthcare services, have increased dangerously with each new wave of COVID-19. But there is a straightforward solution: having more diagnostics and elective surgeries delivered by the private sector, as is the case in most European countries like Norway. This could lower costs dramatically while cutting down those wait times and improving health outcomes as well. Just think about it logically. Every facet of our society has become more prosperous and more plentiful due to the efficiencies and innovations introduced by the private sector. It's the reason why you almost always receive faster and better service at private-run businesses than you would at your local hospital. Now, even with a greater role for the private sector, all healthcare services would still be universally accessible to every Canadian, and there'd be a government-funded option for every procedure and treatment. But we simply must find ways to deliver our existing healthcare services more efficiently and at a lower cost to taxpayers, savings from which could be used, for example, to supply more acute care beds, of which Canada is second last per capita in the developed world. Instead, here in BC, the NDP government has even tried to crush the one incredibly popular private surgical centre in Vancouver, the Cambie. This kind of politics is quite literally bad for our health, unless we have the frank and honest conversations about serious structural reforms. Little, if anything, will actually ever change. And with an aging population and a virus that might be here to stay, this is something Canada simply cannot afford. For the C2C Journal, my name is Aaron Gunn. Thanks for watching.